Good evening, everyone. My name is Simiran Choudhary, and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, and Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025. As we celebrate the strength, resilience, and remarkable contribution of women across the globe, it is equally important to shed light on critical health challenges faced by women, one of them being cancer. So, this session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today we are truly honored to have with us Dr. Poovamma C U, Senior Consultant at Cytecare Hospital, a highly esteemed expert who has dedicated her career to cancer care, patient advocacy, and advancing treatment protocols. Through her exceptional expertise and compassionate approach, she has significantly contributed to improving patient outcomes, offering personalized and comprehensive cancer care that brings hope and healing to countless lives. Welcome to our show, Dr. Poovamma. It's an honor to have you with us.
Thank you. A pleasure to be here.
Thank you so much. And in today's session, we will discuss early detection, breaking screening barriers, advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage regular checkups, and to reduce the fear of cancer. So, without any delay, we would like to start with the conversation. Dr. Bhavama, I would like to know why is early detection so critical in improving cancer survival rates, and can you share any real life example where early diagnosis has made a significant difference?
I think with cancers in general, and in particular, since we're talking think pink and breast cancer in general too, the stage of detection is very very important. So when the cancers are picked up very early, usually the long-term outcomes are much better. Just to give you an example, a stage one breast cancer has a cure rate of 98%. Okay, coming to whereas a stage 4 breast cancer has a cure rate of 20%, meaning we can't cure it, we can keep it under control. So that's the difference. That's the long term outcomes I'm talking about. So whenever we pick up cancers early, for most cancers I should say, the long term outcomes are much better. The chances of survival dramatically goes up, and sometimes the treatment required is very minimal. So that's why screening and early detection of cancers is very important. So like recently we had this girl who had a really tiny tumor detected on a mammogram, and when we did the biopsy it came as a cancer, and for her luck it was a stage 1, and in stage 1 it was stage 1A cancer. But the tumor was, I think, 4 millimeters in size. 4 millimeters. And the variety did come back as a very aggressive subtype, but because of just the size criteria, she didn't warrant any other treatment. If it was anybody else, she'd be looking at 6 cycles of chemo and things like that. So, because it was detected so early, she got away with surgery and her treatment was done. So I think that's what is important, the stage at which it is diagnosed. And what happens in India is a lot of the cancers are diagnosed very late in stage 3 and stage 4. So because of which, though we have international treatment available in India in our Tier 1 cities, our mortality from cancers are way higher compared to the Western population because of the late diagnosis. So I think early diagnosis, diagnosing at the right time is very important, crucial for long-term outcomes.
You said right, and because of the example which you gave, I believe this example will motivate all listeners out there that how early detection can make treatment more simpler, and it can wind up at a very less time as compared to if diagnosed at a later stage. It can take a lot of time, lot of efforts, and lot of emotional and mental strain as well. That's why we are focusing more on the screening and diagnosis process to make them aware about and inspire them about how important is screening rather than just being in that fear why we do not want to
Yeah, I
go and
think
every other.
yeah, a lot of times people fear what is going to come, and though women know that there's something wrong in their body, or anybody in general, sometimes they just procrastinate because of the fear, and that makes things worse because they'll end up at a much more advanced stage.
Ma'am, like we discussed that this is one of a fear, which I believe is the biggest barrier for preventing women undergoing the regular screenings like mammograms, pap smear, or genetic testing. So, how can we break these barriers? How can we, educate, aware more and more women to come out for screening process, especially in rural areas or underserved communities where education or awareness is much lower?
So I think that's the crux of the situation, in the sense to break the stigma that is attached to cancer. So whenever we talk about cancers, patients always, the first thing is, they're worried about recurrence. They're worried, to even to tell family or extended friends that they have a diagnosis of cancer, because they think, how are people going to, react to them, respond to them? How are my colleagues going to respond if I tell them I have cancer, or my family members respond? So I think breaking stigma is the most important thing, and that can be only done with, more talking more about it, being more open about it. Women or everybody in general, being open to the diagnosis and not trying to hide and stigma, and also to not stigmatize a cancer patient. Somebody's going through treatment. Let's not treat them differently in an office setup, or decrease the opportunities that are available to them. So I think the most important thing is the stigma that is attached to cancer. Because see, there's no stigma attached to, say, a diabetes or a hypertension. People openly will say, "Oh yeah, I have diabetes, I have hypertension," but somehow very few people would be, open to tell that, I had cancer, and I know I'm going through treatment. For that. So I think the more we talk about it, and the more we can discuss, forums like this and other forums where companies have people come in and talk, uh, I think will help to decrease this. We also did a pilot project where we taught these Anganwadi workers, who go into the houses in the underprivileged, in the villages, where they go and ask about the children health, because the government runs programs, right? So we taught them, why don't you ask the women also? Okay, do you have any other symptom, anything in the breast, or do you have any abnormal discharge? And try to educate them to, to seek medical attention easily. But that's we need a long way to get there, I think.
I
Because if
you you
you've seen, right, you've seen tobacco and smoking. You can have the movie theaters flashing, and you can have all these actors coming in talking about how tobacco is bad and causes, all the types of cancers. Yet people really don't take it seriously, right? I mean, it's heard, I think, through one ear and just let out. So I think it's more talk about it, normalize it, remove the stigma attached to it. And I think if we can get the message across that early diagnosis indeed is cure, and cancer doesn't mean death, because people think cancer is death, right? So that's the I think we need to talk more about it.
So, like you said about we need more and more such forums, and this whenever we go to movie screens and everything, there is this wide display of what cancer does to you and how does it look, how financially and emotionally it strains, and the family strain and everything. And nowadays, I believe whatever is in social media, people are taking more as a news. That is more of a awareness, like celebrities coming out talking openly about the cancer. Like Hina Khan discussed or openly shared about her recovery journey, the treatment journey, and I think people took it more positively. Even with everything, she is not bowing down to cancer, she's fighting against it, and that's not the end. The willpower is still there. I think we need more and more such kind of cases, representations where cancer does not win, rather than the person who is winning against cancer. And
Yeah.
that's how we can remove the fear and the stigma around people's mind.
Yeah, I think it's more to do with, especially when people of influence come out and talk about it. That's when the youngsters will also wake up, and other people wake up and listen. Otherwise, you can shout it from rooftops, and nobody's really listening to it. So it has to be very trendy. It has to, somewhere make a connect, and yet that might be to a small percentage only. But yeah, so I think people are getting more open about it. There's more people willing to talk about it. I see it with my own patients, how they have changed over the years, right? How from initially, like, don't tell my mom it's cancer, she just get frightened at the thought of having a diagnosis of cancer, to now people coming and saying, I fought cancer very bravely, talk about it. And also I think it's also maybe when they're going through the process, they don't have the courage. But usually once the treatment is over, I've seen how they change and they become a lot more courageous. But people still have that little stigma attached as to what my people around my community are going to talk about. How are they going to perceive me that I'm a cancer survivor? And sometimes it's taken very negatively when people keep asking them, how are you doing well? Patients find that very frightening, I should say. Like, why is somebody going on asking me about my health? And they take it in a very negative way, like, are they irritating me and asking me pointy questions about my health? And it's not taken well. So I think a lot more needs to be done till we get there and it becomes not a taboo topic. But I think slowly we'll get there in the next few years.
Yes, we do not want to make it a taboo topic, and so that more and more open conversation can, be done. More and more stories can be shared and everything. But since we're talking about the screening and the prevention, we believe cancer does the family history does play a role in cancer. So, what role does family history play in determining a woman's cancer risk, and how can this genetic testing, which is nowadays quite helpful in this proactive healthcare approach?
So I think what happens is we always think of family history, okay? And invariably, everybody who comes in and has a diagnosis of family history tells us, "Oh, I don't have a family history. I'm the first one in my family with a cancer." So family history actually plays a very small role in cancer. So only about 5 to 10% of cancers are really genetic. Okay, 5 to 10%. Okay, so 90 to 95% are not genetic. They don't run in families at all. So we call it as that it's not genetic, it's a sporadic type of cancer, meaning to say that individual has had developed a cancer for whatever reason that is, due to the changes that she's been exposed to in her lifetime, and she's not inherited this from the family. So, but family history is important because in the 5 to 10% which are genetic, or a heritable type of a inheritable type of a cancer, there is a lot of clustering of cancers in that family, and these patients tend to be very young, very very young. So sometimes these patients are as young as 20, 25, 23, in that age group. So that's why family history is important. So we ask for family history more to see, what is the risk of that individual developing cancer, and are they at an increased risk to develop at a younger age. So other than that, 90 to 95% don't have to have a family history. So you can still develop cancer with zero family history. But for the 5 to 10% where there's a lot of clustering of cancers in the family, genetic testing is very, very important. Even I would say maybe even 5 to 10 years back, these tests were ridiculously expensive, not easily available in India. But now it's available everywhere, I should say, and it's a simple blood test. They just take your blood, like how they do your normal CBC, and your liver function or a kidney function, and they look at this. They study the DNA, and they can study the DNA to see, do you have any kind of a mutation on your DNA which is going to increase your risk for any particular type of cancer. So they look at the different genes which increases risk for different varieties of cancer. So one blood test can actually look at your genes and tell you, are you genetically predisposed? And if somebody is genetically predisposed, then we see which gene is abnormal. And we have risk reducing methods. What can be like chemo prevention? Can we give them some kind of medicines to reduce that risk? Can we do any kind of prophylactic surgeries to reduce the risk? Or if not that, can we keep them on a deeper surveillance? At a shorter intervals, so that if cancer does develop, we can pick them up at a very early age. So with the advent of genetic testing and that coming in and becoming very very affordable, I should say, in India today, that is available to our patients now. So we're going to, I think, in next few years, the amount of data that's going to be collected from the Indian cohort itself is going to give us such a different picture, because the genes which are mutated in us may be very different from what is mutated in the West, or in the African population. But these tests are being routinely used in offer clinic today, and we do offer it to all our patients where we feel there is a genetic risk of, for inheritable mutation.
So, like we're just discussing about the genetic testing and the screening and prevention. who all comes under the category of suitable or eligible for this genetic testing? We know that it comes from the family, but is it from the mother to daughter or grandmother to granddaughter, or how
So
basically doctors
usually these are
classify?
autosomal dominant. Okay, they're usually autosomal dominant. It can come either from the father or the mother to either the daughter or the son. Okay, so if X, whether the father or the mother is X, they have an inheritable gene mutation, then every child of theirs has a 50% chance of inheriting an abnormal gene. And then that person has again a 50% chance of passing on that abnormal gene to their progeny. So in that 50%, if say somebody misses it, then the chances of them passing on to the next generation is zero. But the difference
Okay.
is, say your grandmother had cancer, and okay, your paternal grandmother, and say maybe we say talk about BRCA1 and BRCA2, which is the most common, genes implicated for breast cancer. So say your grandmother had, but your father, your paternal, I'm talking about, but your father is fine, and still you could get it because these predispose to cancers more often in women than in men. So maybe
Okay.
that's why the father hasn't developed yet. And you think, oh, my father's fine, so I don't have. So I had a very similar patient recently, a 30, 34-year-old girl who had a lump in the breast, kept getting falsely reassured saying, you're just 34, it can't be cancer. So, I'm sure this is related to your cycles. And then the tumor persisted. And then one final day she came to me, and then we did a diagnosis. And there's quite a bit of time lag from the time she had noticed it to till she came to me, maybe at least about 4 5 months. And that time we diagnosed it as a borderline stage 2 stage 3 breast cancer, and we treated the whole thing. And then finally we were trying to trace the history back, and we always do that. But she had not given us the history because her father and mother were fine, and she disregarded her grandparent history. So again, I was just, and then once in one of the follow-up sessions, she told me, yeah, but actually, I just remembered, I think my father's mother also died of cancer. And we picked up on that, and then we said, okay, let's look at this again. And it was paternal grandmother. So the father has skipped. She's got now. And then we did a genetic test, and she came as a BRCA mutated. So
Okay.
then we went back and did it for the father, and the father was also BRCA mutated, right? So because of these things, sometimes people don't realize it's there. Sometimes they miss telling us history until suddenly one day they say, "Oh, wake up and say, okay, this one bit maybe I forgot to tell my doctor." But yeah, so that's how genetic history can be. So typically, it can't skip a generation. If it skips a generation, means the person also is mutated, but maybe because of the sex that they haven't yet, like a male, if like a BRCA1, a male might not have, might not, the incidence for them is much higher than another male, but it's not as high as a female developing a cancer. So that's why they may be cancer free, but they have given the abnormal gene to the next generation. So, but it doesn't really skip like that.
So, how much is the possibility that the patient you were seeing, that may mutate or come to her daughter's gene?
50% chance. It's a
Okay.
yes or a no. So I've had families where they've had 4 children, and 3 were mutated, 1 was not mutated. I've had families where 2 children both are mutated. So you it can be any permutation and combination. That individual's risk is 50%. But if they get it, then again their progeny get it, have a chance of inheriting it. If they get a normal gene, then it won't pass on again. It won't pass on.
Understood. But thank you so much for giving this real life example, because now it makes much more easier to understand what family role does play in, play of this cancer risk, and how does it reduce, and what all are the risk factors could be, and why it is important to understand your family history as well, because it may come to you or to your next generation, or however it may pass
So
on.
I think
But
it's for
thanks.
this particular reason that we always ask family history, but people kind of mistake that a family history is a must to develop cancer. So we are asking because these people tend to develop cancer at a younger age. We can surveillance is in a different manner for them. Treatment sometimes is in a different manner. We're talking about their siblings probably getting cancer, and that's the reason we ask that history. But a family history contributes very little for you to develop cancer.
Correct. So, as we are moving forward with the conversation, and we discussed about the role of family history, and we know how genetic testing has been so helpful. And because of the new advancements in technologies we have nowadays, we have better treatment options. So, according to you, what are some of the most promising breakthroughs in breast cancer, ovarian cancer, or cervical cancer treatments today we have?
So I think in the cancer space, there's a lot of new drug innovation that has been happening. We have lot of new molecules coming in, lot of more targeted therapy. So we kind of personalize the treatment to the individual, to the kind of tumor they have, what kind of. So we're looking at the biology of the tumor. We look in to see. We do tests to see what kind of receptors are seen on the tumor, what kind of mutations are present on the tumor. Can we direct treatment against a particular mutation or against a particular receptor? So because of which medicine is becoming more precise, I should say, or personalized to the kind of tumor, to the kind of subtype of tumor the individual has. In breast cancer itself, we have so many targeted therapies. We have monoclonal antibodies, we have hormone therapy, we have immunotherapy. So based on the subtype of tumor, for including ovarian cancers, we do all these markers to see what is the subtype of tumor come. Can we target this tumor in different ways? Okay. And the other additional benefit with why cervical cancer risk is coming down, I think we should talk about the cervical cancer vaccine that is available today in India. I mean, all over the world also. So cervical cancers are typically caused by a virus called as a human papilloma virus, or the HPV virus, which not only causes cervical cancer, but also some varieties of head and neck cancers, anal cancers, penile cancers, warts, right? So this is a virus which causes long-standing infection, which predisposes, changes the cells in the body and leads to cancer formation. So the virus has helped to reduce the incidence of this cancer. So we advocate vaccination against the human papilloma virus for boys and girls. Actually, the ideal age group is about 9 to 26. So I would say please talk to your pediatrician doctor to get vaccinated. It helps to prevent so many types of tumors, and that's one way we can reduce the incidence of these cancers.
Yes, definitely we can because of the new technologies, we have that option, right? And this is being very helpful for us as well. So, as we are talking about the new advancements, so with AI, which is a new buzzword in every other sector, whether you call it healthcare also. So, with AI and technology improving diagnostics, do you think we will soon have some home-based or non-invasive screening methods for women cancers?
So AI maybe may come into place to read, reports, to maybe to read reports, to maybe make it easy in the periphery to get these smears done for pap smear and get the AI to report it. AI is not yet fully in the treatment space. It's more in the diagnostic space, I should say. AI is also being used to read mammograms to increase the accuracy of picking up tumors. Home-based detection, there is a lot of study going on. So there are, if you see out in the market, you'll see a lot of these thermolytics and thermography, which are being used in the non-hospital setup. But yet today they have not reached the gold standard, which is a mammogram. They can still miss a lot of the tumors. So it could be, I would say, a basic screening at least. Because it's very difficult to get women to the hospital. So when I've done many of these sessions, people ask me, "Can you bring the mammogram machine to our workspace?" Okay, and this is a huge machine which has to be in a controlled environment, and so I'm like, this test is done once a year. I mean, I think once a year you can make time to come into the hospital to do these tests, right? So I think there are a lot of tests, a lot of things being done, worked on, but as of today, none of them have reached adequate accuracy levels, which I can advocate and say, yeah, go ahead, do this test at your home, and I can guarantee that you are cancer free as of today. So we don't have anything as of that available yet, but I'm sure there's a lot of research going on, and maybe in the future we might, there are a lot of other studies looking at, what kind of chemicals are, present in your sweat, and different things like that, to see whether, some kind of molecular gene can be picked up, and to pick up early cancers. But as of today, there is nothing yet out there which I can say you can do at home, and I can tell you you're completely cancer free. And I think it's also the mindset that we need to change. We have this mindset of, when something goes wrong, I will look at it. Until something really troubles me, I will not go to the hospital. If I go to the hospital, I'm sure they'll come up with something that's wrong in my test. Like, I remember I had one lady who came with a screen detected tumor very early, and she was like, "Oh, maybe I shouldn't have come for screening." So I was like, how does that make a difference? You be happy that we have screened you, we picked up a stage one cancer. And if we hadn't screened you, maybe in a year or whatever months down the line, you'd have come with a more advanced cancer, more requiring more treatment, or if not even more treatment, maybe worse long-term outcomes. So I think it's the mentality that we also have to change, and also that we make time for our own health, we take responsibility for our own health. I think we are not yet a community as such who likes to take uh, uh, um, responsibility for our own health. I think we deal with health issues only after it happens. We don't want to take preemptive steps to improve our health. Okay. And I think that's something that we as a community, as a group, have to change.
Correct.
We
I
have to,
think that's why.
like, I remember one
Yeah.
person telling me that, because we, with work and everything, we kind of forget, right? When have I done my last test? So one doctor one day told me, I have a standing birthday arrangement with my friend. On my birthday, we go and get our mammograms done. So I can never forget whether I've done it or not. So I was like, that's an excellent birthday gift to yourself, right? And then she said, you do what you want in the second half of the day. The first half of the day is we go get our medical screening done, and then we go have lunch. And I was like, that's a really ideal way of, celebrating your birthday. And, you're never going to
That's
forget that you've done it or not done it that year. So I think it's
Yeah, and you have a very good record now. Every report is fine. Everything is good. Now I can go and
yeah,
party
and it's
hard and
yeah,
enjoy my day.
yeah,
So I
true,
think
true.
that's a very good example. Everyone can learn from this, that give yourself a birthday gift on your birthday to get all the screenings done, and checklist all the boxes that you are
Yeah.
fine, nothing wrong, and you can enjoy your day. Yeah,
So that
that
even
that's a
made
great
me
example.
wake up, and I was like, yeah, so maybe, I have to find some day where I want to flag in and put my diagnostics on that day and remember it, right? Because otherwise the life just goes by and you just don't remember
Yeah,
when you've done the test last. Yeah.
very.
Yeah, I can't hear you, Simran.
Hello, hello.
Hello, yeah.
Can you hear me, Dr. Poovamma?
I can hear you.
Hello.
I can hear you. Hello, I can hear you, Simran.
Hello.
I can
Am I
hear
audible
you.
to you?
Yeah, yeah, you're
Yes,
audible. Yes.
yes.
Yeah.
Yeah, we are back on the screen. I'm sorry, I this might be because of the internet connection. But yeah, as I was mentioning that we are moving close towards the end of discussion. But I would like to know, what advice would you give to women today, as this is an ongoing celebration of International Women's Day by Voice of Healthcare and Kerala Oncology. So, what advice would you give to women today to take charge? of their health, for the cancer risk and overall health life.
So I think with the kind of lifestyles that we're leading, balancing your home, your family, your careers, we hardly ever make time for ourselves, and a lot of the health I mean the diseases are lifestyle disorders, and the things that we can do actually to prevent is maybe healthy eating, exercise, very important. Try to reduce your stress and maybe sleep right. And I would say, as long as you're fine, your home will be fine, your family will be fine. The day the women of the family gets sick, whatever be it, that's when the whole family will bear the brunt of it.
Yeah.
So, to prevent that, you make time for yourself today. So, someone once told, when one day I was scribbling and saying, "Where's the time to exercise?" They turned around and looked at me and said, "Don't you eat 3 meals a day?" And I was like, "Oh, yeah." Then why can't you put in your exercise as a meal time? You have to schedule that. You can't say, if I have time, I'll have breakfast, right? Or if I have time, I'll have dinner. The same way it should be, my exercise time is the time I devote for myself today. So I think we need to devote times for our own health, and realize that as long as we are healthy, our family also will be healthy. And the day we fall sick, and that's the day the whole family will have to bear the brunt for it. And this is something we see very, very often in the clinic, right? Young women coming in with cancers, tumors, and we see what repercussions the whole family has. The whole family breaks down. So I would say, before you think about somebody else, put on your masks first. Look after your own health first, and that's very important. And until you take that decision to eat healthy, sleep healthy, exercise, try to reduce your stress, have more fun too in life, you know nobody can do that for you.
Rightly said, no one will come and say these things in a year, that you have to do this and that. They may come and say for one or twice or thrice, but ultimately you have to take charge of it. And just to get that motivation again and again, just to spread this awareness, just to inspire everyone out there, how you have to take charge of your health, how you can lead your life healthy, how you just have to push back all those fears which comes under, it becomes a barrier for the regular screening and diagnosis. That's why we are doing these kind of sessions. We need more and more doctors who can spread awareness like you did, giving such good life examples where we understand the importance of each and every aspect of our life, of our health, especially women. Like you said, if a woman gets sick, it disturbs the whole family. So thank you so much, Dr. Poovamma, for sharing that awareness, for inspiring other listeners out there to take charge of their health on this special occasion. And it means a lot that you have shared your valuable insights with us. Thank you so much. It's a pleasure to have you with us.
My pleasure.
Thank you.